L is for the way.
At petfix-club, we want to make owning a pet the best it can possibly be for you and the one you love. Enjoy personalised online pet care at petfix-club.com. Start your free trial today. Love your pet? Join the club.
Hi, and welcome to this session about arthritis in pets. I do an IGTV session every week, and my aim is just basically to inform people about pets, in particular about health issues to do with pets. And in the past, most of these sessions have been interviews with people, so people doing interesting things in the pet world, whether it's search and rescue, whether it's companion service dogs, or whether it's people, high-profile pet owners. A whole bunch of different people I've been talking to, and I'll carry on talking to people as well, because I think that's one of the best ways to learn, is to have a two-way conversation. But this week, just as a bit of a change, I'm going to be just me here on my own, and I'm going to be talking about a very common problem, which is arthritis in pets. It's common not just in dogs, but also in cats. Hey Finzi, what are you doing? She's just finished her dinner, and she's looking at me and barking at me. It's all right. Anyway, and I'm here, by the way, as one of the co-founders of petfix-club, which is an exciting new website where we aim to give high-quality veterinary information to everybody, everywhere, all the time. You pay a small subscription for that every month, but in return for the subscription, you can ask me as many questions you want about your pet. You can send me photographs, videos, and I'm happy to give you the best advice I can to supplement what you get from your own vet. I'm always very clear, petfix-club is not about replacing vets, it's about helping you get more from your vet, helping you know when you need to go to your vet, and giving you extra information. That's my aim. We also have petfixshop.ie attached to petfix-club, and that's about offering really good quality products at good prices, products that I know are really good for your pets, that will help your pet, and that's the aim of this. So today we're talking about arthritis. So there's lots of misunderstandings about arthritis, I think. And so the first, and what I'd say to anybody watching, if you go to petfix-club, you can see I've done a specific video, like a carefully planned and even scripted video about arthritis in pets, which really is quite succinct and to the point. So you can watch that later on if you want. Today, this is more of a casual chat where I'm really just, I suppose, looking at it from the point of view of the typical punter as to, you wonder what arthritis is and what can be done about it. So I'm going to just tell you that quickly. Okay. So the clue to any disease is to look at the name. And the name of arthritis is ARTH, arth, which means joint, and itis, which means inflammation. Itis means inflammation, which means redness, swelling, pain, lack of function. If you look at a joint that's inflamed, if you opened up the joint, you'd see it was red around the joint. There'd be redness. Same sort of redness that you get if you scratch your arm for a few minutes. It would become inflamed and you'd see the redness. So the lining of the joint's inflamed. It's swollen, just like if you scratch your arm, it gets swollen. So the joint's swollen. It's hot. If you scratch your arm, it becomes a bit heated where you've scratched it and where it's red. And equally, a joint with arthritis is hot. And there's lack of function, so a joint doesn't work properly when it's inflamed. And finally, there's pain. Just as your arm gets a bit sore if you scratch it for a while, so an inflamed joint is sore. So arthritis is also known as osteoarthritis. That's a longer name, and it's more correct technically, because arthritis just means inflammation of the joint itself, whereas osteoarthritis means inflammation of the bone. So that's my elbow joint there, okay? That's my elbow joint. Well, it's not just the joint itself that gets inflamed with arthritis, it's actually the bone, the top end of this bone and the bottom end of this bone, they all get inflamed. That's why it's called osteoarthritis, because bone and joint are inflamed. So it's the same thing as arthritis. There's another term people tend to throw around, and that's rheumatoid arthritis. But that's very specific autoimmune type disease. And dogs can very, very rarely, and cats, get a type of autoimmune arthritis, but really it's exceptionally rare. I might diagnose a case like that maybe once every 5 years. What's far more common is osteoarthritis, also known as degenerative joint disease, and all that means is it's arthritis caused by the wear and tear. Every time a joint is used, every time a dog walks, there's a bit of pressure on that joint. Every time a cat jumps down from a surface, there's a little bit of pressure on the joint, and that repeated pressure over weeks and months and years causes a little bit of damage to the joint, and the joint then changes from being like a smooth hinge that moves freely and very easily into being more like a rusty hinge, which it moves with more difficulty, and it causes pain to the animal when it moves. So that's what happens with arthritis, and because it's associated with wear and tear generally, that means that we more often see it in older animals, and so very high percentages of dogs and cats over the age of 10 have arthritis. I suppose the exception to that would be that we do see arthritis prematurely in certain breeds of dog in particular that are prone to joints that don't form properly in the first place. So what I'm talking about is hips in particular, and also elbows, and sometimes knees, and sometimes shoulders, where there's as the animal is growing, the joint doesn't form quite properly. So, for example, with hip dysplasia, instead of there being like that's the top of the thigh bone and that's the hip, instead of there being a nice deep ball and socket joint like that, the hip joint is very shallow, and the top of the femur is kind of not properly semi-spherical. It's more oval, and they don't fit together neatly. They kind of wobble around. Because of that, they're prone to premature arthritis. So that's what hip dysplasia is, and that's why some breeds of dog, like golden retrievers or German shepherds, even by the time they're a year of age, they're limping, and by 2 years of age, they're so lame that their owners have to consider a total hip replacement, because the hip is so arthritic at that early age. And that can also happen, by the way, with the elbow and shoulder and with the knees. So, early arthritis can happen, but it's very rare. So most of the time we're talking about older animals because of wear and tear. Wear and tear is more likely to happen if animals live very, very active lives. In particular, if you've got a big breed of dog, as I said, German Shepherd, Golden Retriever, Golden Labrador, Rottweiler, big breed of dog, if you over-exercise them when they're young, as in, before they're skeletally mature, so usually that means before about 18 months of age, if you take them like for 10-kilometer runs over the hill when they're that young, you can end up damaging their joints as they're forming, and that then makes them more prone to developing arthritis as they get older. So if you've got one of those breeds of dogs, you're meant to restrict their activity when they're young. Oh, there's somebody called Peg wants to come and be on this video with me. Do you want to? I'll just press on. No, I better not actually. I'm not quite sure who Peg is. This is meant to be a semi-organised video, and that means that we don't just let people like Peg join us. Although it would be kind of fun to do that sometimes, wouldn't it? Only planned guests, I'm afraid. Anyway, what was I going to say to you? I've lost the thread of it now. So what are the signs of arthritis? Well, the signs of arthritis generally are associated with stiffness and pain of the joints. So it depends on which joint's affected. Typically, you'll have an older dog that might be very slow to get up in the morning. And you'd find them sort of hovering in their bed for a while and then groaning as they push themselves up, especially on their back legs. Typically, you might have an older cat that gets to the bottom of the stairs, looks up the stairs, pauses, and then starts to hobble slowly up the stairs. In both cases, it's because the joints are stiff and sore. Often it's worse first thing in the morning because as the joint's resting, not moving at all, if it's inflamed, the joint tends to fill up with fluid. And because it's filled with fluid, it makes it even more stiff and even more painful. Then as the animal starts to move around, the fluid disperses and it gets a bit easier and animals move more freely. You'll also find animals are often much worse after exercise. So if you take your dog for a long walk, you'll find they'll be limping badly at the end of it. It's quite hard to know to confirm the diagnosis by yourself that your vet has arthritis. sorry, that your pet has arthritis, you can strongly suspect it. You know, it's very likely if you've got an older pet and they're stiff and having difficulty moving around, it's very, very likely that they have arthritis. And you can take some general steps to help them in that because you suspect it, but you're really better to go to your vet to get it confirmed. What will the vet do? Two things. First of all, the vet will examine the animal, and by literally feeling the joints, once you're used to doing that, as we vets are, you can tell very easily if there's stiffness, if there's roughness of the joints, and if there's pain and swelling, all of those things. And you know that by examining the animal. It's very hard to explain how you do that. It's something vets learn by reading about it and then by getting experience at doing it. Now, to confirm the diagnosis, you have to do diagnostic imaging, and that would mean taking X-rays or even MRI scans or CT scans. In truth, we often don't do that because it's often so clear and so obvious that the animal does have arthritis. So in many cases, we'll just treat them for arthritis anyway. And if they don't respond well to treatment, you might go, okay, we better really be sure there's nothing else going on here. We better go ahead with those X-rays and so on. But we don't always do that. It really depends on the individual animal. X-rays are fairly definitive because you can actually see the outlines of the bones. And in a dog with arthritis or a cat with arthritis, you'll see this new bone there. There's lots of roughness around the edges. Of the joint's meant to be smooth, like a line that's cut with a sharp knife. That's what the joint edges are meant to be like. Whereas when there's arthritis there, they're much more kind of wobbly, like somebody's got a pencil, and they've done a wobbly line and then they've smudged it. That's what you see around the edges of joints with arthritis. And that reminds me to mention what you see on X-rays with hip dysplasia, which is this very shallow joint in the sort of ovoid top of the thigh bone. You can actually measure how good a hip is, and that's called a hip score. And one of the things that's been done to try to prevent hip dysplasia, which is an inherited disease, is to take X-rays of dogs before you breed from them, and you get what's called a hip score, which is a measurement of how good or how bad the hip is. The lowest score is the better. And the idea is that if you only breed from dogs with really low hip scores, then they'll be far less likely to produce puppies that grow up to have hip dysplasia. So if you're buying a puppy of a breed that's prone to hip dysplasia, what you should do is make sure that the parents that the puppies come from have been hip scored and have they got very low hip scores. There's a very detailed science to that, and I could talk more about it, but all you need to know is don't buy a breed that's prone to hip dysplasia without making sure that the parents are hip scored. Okay. By the way, if anyone's got any questions through this today, any questions about arthritis at all, you can just click on the question button there and I'll answer the question. Like one has just come in saying, are some breeds more prone? Yes, indeed, some breeds are indeed more prone to arthritis. In particular, the large type breeds, German Shepherds, Golden Retrievers, Labradors, Rottweilers, most of the medium-large breeds actually. The one breed that doesn't almost ever get arthritis is the greyhound, and that's very simply because greyhounds have been bred as performance animals. They've been bred to run, and so that means that if a greyhound was found to have hip dysplasia at the age of 1, well, they wouldn't race it. They wouldn't be able to race, and they wouldn't use it for breeding because it's obvious that it's going to use puppies that can't run. So for all the problems of the greyhound industry, they have actually produced a breed which is extremely fit and healthy because they've focused on getting animals that are athletic. So a good thing about greyhounds, they don't get arthritis. At least they do get a bit of wear and tear when they get very old, but it's much, much less common than in other breeds. So that's how you kind of diagnose arthritis. Well, what can you do about it? Well, I always say there's 3 things that you can do, and 2 of them are completely free of charge. The first thing you can do is make sure your pet's at their optimal weight. It's if you can imagine, if a joint is sore, the more pressure that's on that joint, the more painful it is. And that means that the more weight your pet is carrying, the more painful the joint is. As well as that, just day to day, the more weight that's applied to joints, the more damage there will be, the more wear and tear there will be. So the best thing you can do for your pet to prevent arthritis is to keep, and to treat arthritis as well, is to keep them as lean as possible. If you're not sure, we have a really good video on PetFix about doing body condition scores of pets. You know, you should be able to feel the bones of your dog's spine. You should be able to feel their ribs. And they should have a nice little waist when you look at them from above. And with cats, you know, it's important that they're lean. So that's the first thing for preventing and treating arthritis. The second thing is to moderate the exercise. What that means is that you don't want to give an animal too much exercise if they've got arthritis, nor do you want to give them not enough, because if they get too much exercise, they just stress the joints too much, and then they're continually painful. And if you don't give them enough exercise, then they basically, if the joints aren't moving, they seize up even more. And the idea is you want to get the joints moving to their full extent as much as they can, and that means I would say regular walks, sort of 15-20 minutes twice a day. And you want to try and vary the surface. So, for example, if you're walking on a pavement, you'd want to. The ideal thing would be to go along a pavement where you can step down for a while, walk along a bit, and then step up for a while, then down, and then up. And that extra movement of the dog just pushes the joints a little bit more than they would normally push, and that then is good for them. Also, going up hills and going down hills, going around corners, all this sort of stuff. A bit of variety is good for them. And of course, swimming also is well known as being good for dogs with arthritis, because swimming means that the muscles are moving, the joints are all moving, but that there's not actual pressure on the joints. And the stronger the muscles are, the more easier it is for dogs to move joints that are stiff and a bit uncomfortable. If the muscles get weak, then they can't move the joints anymore, and then that makes them seize up even more. That's kind of what happens. So anyway, so those two things are free of charge: getting your pet to the optimal weight, and also giving them the right amount of exercise. But then you get into the treatments that you pay for, and these are really important, and a lot of people don't realise how simple they are. So the most simple one is a group of drugs called non-steroidal anti-inflammatory drugs, NSAID, non-steroidal anti-inflammatory drugs. Now, the broad group of drugs is aspirin is in that group. Okay, so it's that type of pain-relieving tablet that we all take all the time for all sorts of reasons, you know. But the thing that you have to realise is that dogs, and especially cats, they work in a different way to us. Their metabolism is different, so you can't just give human non-steroidal anti-inflammatory drugs to arthritic dogs. And if you try to do that, there's a serious risk that you'll kill your dog or your cat. And I know of many instances where that's exactly what's happened. So please don't do that. Nowadays, there are a whole number of really good, safe, non-steroidal anti-inflammatory drugs for pets with arthritis. So in dogs, the well-known brands would be things like Metacam, and there's lots of generic derivatives of Metacam nowadays, like Loxicom and Rumacom. There's lots of different ones. As well as that, there would be Rimadyl, which is a drug called Carprofen, and then Previcox, and then there's a newer one called Galliprant, a whole bunch of different drugs of a similar type. And what people generally do is vets would recommend they start off with one type and then they see if it suits their pet, and then, you know, sometimes they can change that if they have any problems with it or if it stops working so well. So but these are all prescription only drugs. What that means is you have to get them through your vet, and for a vet to prescribe them to you, your vet has to have an active relationship with your pet. They need to be treating your pet regularly. You know, that means that you have to see the vet, I don't know, at least every 6 months to make sure that the condition isn't changing or whatever. So these drugs are very effective. They do have some side effects occasionally. They can cause an upset stomach, like vomiting and diarrhea. And very rarely they can affect the liver and kidneys. So they are drugs that need to, that's why they're prescription-only drugs, because they can cause problems if they're not used appropriately. And sometimes blood tests are needed to make sure that pets are still safe for them to give them. Anyway, they're probably the most common drug that's used, and dogs can be on those, and cats, they can be on that medication for months and years. And honestly, it transforms them. You get dogs that look like they are so unhappy that they should be euthanized. You put them onto non-steroidal drugs and they are like different animals. They cheer up so much. So only then you realise how much pain they were in. When you give them pain relief, they are transformed. So if you know any old creaky dogs, do ask the people to talk to their vet about going on to non-steroidal anti-inflammatory drugs, because it's like a magic drug, really. But that by the way is for years was really the only highly effective treatment. But just very recently, as in the last 6 months, there's a new highly effective treatment that's just come out, and it really is quite dramatic. And what it is it's a kind of highly technical drug. It's an injection which is given once a month. And what it is a monoclonal antibody against nerve growth factor. And what nerve growth factor is it's one of those biochemical things in the body which carries the pain sensation from the joint to the brain. That's essentially it. And so what the monoclonal antibody does is it neutralizes the nerve growth factor. So it dramatically reduces the levels in the blood of nerve growth factor. And what that means is it also dramatically reduces the pain the animal's feeling. It's not available in humans yet, this drug, but it is available in dogs and cats. I've seen it myself in my own cat, Sushi, who's a 16-year-old cat who has serious and painful arthritis. And she's been a particular challenge because she has got quite advanced kidney disease as well, which meant that I was very reluctant to give her non-steroidal anti-inflammatory drugs. So I started her on this new drug. It's called Librela, and really it's just incredible. She has gone from hobbling around to walking around really quite freely. But again, it's prescription only. You need to talk to your vet. Eileen Collins is there. Hello, Eileen. Good to see you. And Eileen's asked a very good question. Will long-term use of non-steroidal anti-inflammatory drugs shorten a dog's life? Do you know, the answer to that is no. I mean, there would be the occasional animal that would have a bad reaction and might have liver or kidney complications from non-steroidal anti-inflammatory drugs. But it's not one of those drugs that has a sort of additive effect over years and years and years. Like, it's metabolized very quickly, it's gone out of the system, and it doesn't have a sort of residual effect in the same way as some other drugs like steroids might have, or like phenobarbital, anti-epilepsy drugs might have. It's not like that. So no, I'd say rather than shorten a dog's life, it lengthens a dog's life, because there's lots of dogs that people would have them put down because they think they're so miserable. And if they're on non-steroidals, they're happy. So they don't get put down. So I think it's a life-extending drug, not a life-shortening drug. I would say to you as well, by the way, those are the main treatments, really. Non-steroidal anti-inflammatory drugs and this new monoclonal antibody. There are other treatments that can help a bit. In particular, there's an injection which is called pentazan polysulfate. It's an injection, also known as Cartrofen, is the brand name. Give an injection once a week for 4 weeks in a row, and it has a kind of residual effect then over many months. And it acts as an anti-inflammatory and also is supposed to improve the actual health of the joint. So that's a good choice for some cases. Also, there are supplements, so-called nutraceuticals. Glucosamine chondroitin sulfate is the one that's most commonly used. R3 Aid is one brand name. There's Umega, Umove. There's a whole bunch of different ones that you can get, and that helps a bit in some cases. It's kind of hard because there's a big study done which showed that in humans actually it doesn't make enough difference at all. So the jury is out about how good glucosamine chondroitin sulfate is at actually making a difference. I think it certainly doesn't do any harm, but it'd be wrong to think it's going to transform your dog. It doesn't do that. It helps a bit, but it doesn't. It's not like a magic drug like non-steroidals and like monoclonal antibodies tend to be. Also, giving extra essential fatty acids can help. So, for example, Coastal Nutrients mackerel oil is a good one to use because it's got high levels of essential fatty acids, in particular omega-3 fatty acids, and that has a general anti-inflammatory effect. And I am Joe Bulmer. Hello, Joe. Joe's asked for the best treatment for a 9-month-old Springer Spaniel seems to have runny nose and irritable ear. Well, Joe, I wasn't really going to be talking about other things than arthritis, but since you're there, runny nose and irritable ear, in the middle of the summer, first thing you think about as a vet is some sort of allergic reaction. So I would be saying to you, talk to your vet about some sort of anti-inflammatory medication. Could be, antihistamines could be used for starters, but more often, stronger anti-inflammatory medications such as prednisolone, corticosteroids are often recommended. But really, it's a case of talking to your vet about that one because there's lots of other possibilities as well. Okay. Now, where were we with arthritis? Somebody's got there's a few more questions here, which I'm just going to ask to you and then answer. First one is, at what age would an animal be more likely to get arthritis? Well, I would say, really, at any age it can happen, but it's far more common in animals that are older. So any animal over the age of 10, and really it's a case of observing their behaviour, especially in the morning. Are they slow to get up? Or at the end of a walk, are they limping? These are all really clear signs that an animal has arthritis. Does weight affect arthritis? Yes, it does. Extra weight puts extra pressure on the joints, and it's almost like a cure for arthritis sometimes, in that if you have a very obese animal, they can be creaking around, really suffering with arthritis. Then you get them to lose weight, and they're almost like transformed, and it's like they're cured of arthritis. So extra weight has a really negative effect on arthritis. Is it more common in dogs than cats? We used to think it was more common in dogs. We used to, and funny enough, 25 years ago, experts would have said to you, cats don't get arthritis. But now we know that actually they do. It does present differently to dogs, because cats tend to just get a bit less active and then just sleep more. And so, like with a dog, you'll notice because they're on a walk and they start to limp. You won't notice that with cats so much. But we now know from lots of studies using X-rays and CT scans that it's very, very common indeed in cats. It's just not recognised as much. And the Irish Pig Society, hello there, they just asked, do you see arthritis in other animals than dogs or cats, I suppose? Well, that's a good question. Yes, you do. You actually see it in all older animals. Older horses, older cows, older pigs, older chickens, older sheep. The thing is, you don't tend to, our society doesn't tend to let those animals get older, do they? Because they, farm animals aren't allowed to go into old age because they're killed because they're not being productive. They're killed before then. So we don't. When you will see it is if you go to any of these farm sanctuaries where they keep farm animals into their dotage. You'll see then that you'll notice that they do have older farm animals with arthritis, just like older people and just like older dogs and cats. So it's a common problem. So look, there is more to talk about with arthritis, and I would say again, go watch the video that we have done. It's very specific about arthritis in PetFix Club. If you just go to PetFix Club and you click in, put it under press the little search magnifying glass and click in and write in arthritis, you'll get shown there's a few articles about arthritis, and there's also a video all about arthritis. So it's an interesting topic, and I'm glad to be able to talk to you about it a bit today. And from time to time now, rather than having guests, we're going to cover a few different common topics, because as well as talking about them on the night, what we'll also do is we'll put them up on YouTube afterwards. So they'll be there as like a little library about information about pets. Okay guys, I'm going to leave it at that now. Thanks very much for joining us, and I'll see you next week hopefully.
L is for the way.
At PetFix Club, we want to make owning a pet the best it can possibly be for you and the one you love. Enjoy personalised online pet care at petfix-club.com. Start your free trial today. Love your pet? Join the club.